Sponsored by Simpson Dental Associates.
And welcome back, audience. I'm Shay Paul, and I'm here in the studio today with Dr. Kristen Simpson from Simpson Dental Associates.
Yes.
Kristen, it's nice to have you here as always.
Well, thank you. Great to be here.
I understand today we're going to talk about, we hear DIY when it comes to home improvements,
Right. Yes.
But there's actually DIY dentistry as well, which is a little scary. So we're going to talk a little bit about that today.
Sure, yes. There are some things, I mean, of course, taking care of your teeth at home is very important to maintaining good oral health, but there are some things that you shouldn't be doing to your teeth yourself that you should rely on a dentist to do for you. And one thing that we've been seeing a lot of is mail-in ortho. So patients are taking impressions themselves at home, mailing these impressions into a company that's making them the clear aligners that are moving their teeth without a dentist ever seeing this patient. This can be very risky for the patient because as those teeth move, it can affect your jaw joints, it can affect the way your bite's coming together. So you really need to make sure that a dentist is monitoring your teeth movement and making sure you're getting the best results with ortho.
Right, yeah.
Yes, and another thing is using the over-the-counter cements for temporaries. You know, it's okay to use that if it's going into a weekend or if you're on a trip and you can't see your dentist, but to use it as a long-term option for replacing a filling that's come out is not something that you should be doing. You need to make sure to see a dentist if a tooth breaks or a filling comes out.
Right. Quick fix is not always the best fix.
That's right. Yes. And the online remedies for toothaches or for gum treatments like oil pulling or cloves for toothaches, those might help a little bit, but you definitely need to have the tooth treated, which is the source of the toothache, and you need to see a dentist to see how best to take care of that.
Because those products are just treating the symptoms and not the actual cause.
Exactly. Right. Yes. So another thing is the whitening with charcoal and baking soda. There are a lot of online ways to whiten your teeth, and a lot of these are not approved through the American Dental Association, so you're taking a lot of risks by using these, and you can end up harming your gums. It can abrade your teeth. It can even cause them to stain more rather than whitening them.
Wow.
So you want to steer clear of those. Another thing is using the night guards that are over the counter. You boil them and shape them to your teeth. It might be okay to use it for a little while just to see if that night guard is going to help. But if you're going to be using it for an extended amount of time, you need to have one that's made professionally that fits your teeth the way that it should.
Right.
Yes. And then the last one is using the at-home scalers. You know, it's okay to use aids at home to help brush and floss, but nothing replaces going to have your professional cleaning.
Right.
So you still need to be going every 6 months to see your dentist to have your teeth cleaned.
Right, right. And Kristen, you have a seminar, a dental implant seminar coming up not long from now, right?
Yes, it's in June 25th at 5:15 at our office, so you can call or go online to find out more information about it.
Okay, very good. Well, Kristen, as always, that's great advice. Thank you so much for being with us today.
Sure.
And we'll be right back.